And so again, we can do that through one-on-one consultations, or if you just want to give us a quick call, we can do that as well. The Information and Resource Center also puts on this, exactly what you're attending today, free seminars and educational opportunities. We like to do this on the months that we are not hosting a conference or participating in a conference. And we also work on several different conferences throughout the year. We have our Williamson County Caregiver Conference. We have a Striking a Balance Caregiver Conference that's coming up soon in August, and we partner with the Area Agency on Aging to put that on. These conferences are at no cost to you. You just register and attend. And this is all, again, no cost to you. We also have a Pflugerville Seniors Conference, and we have another conference that is for new caregivers, and this is the Caregiver Training Camp Conference. So we have these annually, and you can always find all of the dates and registration information on our website for the conferences. So again, we have the Striking a Balance Caregiver Conference coming up in August, and that's the one that we partner with the Area Agency on. This year, we will be hosting a hybrid conference, which will have 3 days of virtual or online information sessions covering different topics. And then following those online sessions, we will have an in-person luncheon, and that will be, you will need to register if you're interested for that, because we are limited with how many people we can have actually in person at the location. Again, all of that information is on our website with dates and times and registration information, and I encourage you to sign up if you're interested. So again, this is our Information and Resource Center. It's the one-on-one consultations. It's helping you navigate community resources, and maybe even helping you understand your situation a little bit better through just a conversation and identifying some needs that maybe you weren't fully aware of at the moment. Another one of our programs is the Health Equipment Lending Program, and we like to call this Office Help. It's the HELP program. We provide free durable medical equipment to the community. We have wheelchairs, standard walkers, rollator walkers, which are the ones with the wheels and the seat, as seen in the picture. We also have shower chairs and shower benches, toilet seat risers. We have a ton of crutches, and sometimes we'll have other equipment that's not listed, like a knee scooter. And these are all available to anyone in need of the equipment. This particular program is currently operating on an appointment-only basis. We want to make sure that we keep everyone safe. So if you are interested or in need of a piece of DME or durable medical equipment, I encourage you to contact our help office, or you can email them as well. And we can make sure that we have the size of the equipment that you need, and also just make sure that we have it, so you're not having to drive all the way to our building and we might not have the item available. We want to save you a trip. And then we can set it aside for you and then schedule a time for you to come pick it up. You can keep it for however long you need it. There is not a time limit. So if you keep it forever, that's great. You can do that. Or if you pass it on to someone else who might be in need, that's fine too. Another really wonderful part of this program is the monthly incontinence supplies that are provided to the community. So once a month, at any time during the calendar month, but just once a month, we can provide adult pull-up underwear, bladder pads, bed pads, wipes. This is again at no cost to you. This again is once a month. We do not provide enough for the entire month, but we can offset cost with these supplies are often super expensive. So if we can help you by providing you with some additional assistance in saving some money, please reach out to us and we can get that scheduled for you to pick up. Again, the program is appointment only at this moment, and then you can contact us to schedule appointments or inquire about equipment by just calling us or sending us an email. And please, as we move through this presentation, drop any questions in the chat box. I already see that a couple of people have dropped some chat, so please go ahead, drop a chat or a question in the chat box if you have any questions that come to you during this presentation. So our next program that I'm going to talk about is our CaregiverU program. This program is for family caregivers. We have 3 programs or classes. One is called Powerful Tools for Caregivers. And this class will go over how to balance your life as a family caregiver, how to take care of yourself while taking care of someone else. There are communication techniques that are discussed and taught. There are tools to use to make time for yourself or set some goals for yourself. And so it's a wonderful, well-rounded program that will provide you with stress-reducing tips and tools, how to get organized, communication tips and tools to help you just balance your life as a caregiver, because that is, it's a lot of work. And oftentimes caregivers take the back seat in taking care of themselves. And this particular class just helps give you some ideas and tools on how to make sure that you do remain, taking care of yourself as a caregiver. So that's the Powerful Tools for Caregivers class. We have another caregiver class that is called Savvy Caregiver. And this particular class is for the dementia caregiver. You are the caregiver who is taking care of someone living with dementia. And so that is a very different type of caregiving. There are communication tips and tools that are discussed. There's a portion of just dementia education. What is it? So you can have a better understanding of dementia and all the different types of dementia. So that's our Savvy Caregiver class. We also have another class that is just for really anyone, and it's a Matter of Balance class, and it's a falls prevention course. So this is how to avoid a fall within the home. You will be given some homework to identify areas in your space that could potentially lead to a fall. We also have during this class a physical therapist that joins, and there are some muscle building exercises and so it's a really wonderful class for just anyone. I encourage anyone to take it, no matter your age. And I know there have been times where I have fallen down the stairs or have tripped over a rug, and I could definitely benefit from taking this course. So again, it's for really anyone. Before I move on to the next slide, I just want to mention that these courses are 6-week courses. So you meet once a week. It depends on the partner agency that is teaching the class, but you will meet once a week for about an hour and a half to 2 hours. It depends on the particular course that you sign up for, once a week for 6 weeks. And so I mentioned that because we have, let me get to my next slide. We have our CaregiverU Empowering You class series. And these classes are a little bit more condensed class of the powerful tools for caregivers, the A Matter of Balance class, and the Savvy Caregiver class. This particular class series will typically meet for 1 week. For an example, I just taught Empowering You to be a Strategic Dementia Caregiver. And we met over the course of 1 week. We met on a Monday, Wednesday, and a Friday for 1 hour. And then that was the entirety of the course. So again, we hit a lot of great topics that are still within the Savvy Caregiver and Powerful Tools Caregiving classes, but it's in a shorter amount of time. So the Empowering You to be a Smart and Healthy Caregiver, that is the one that is going to it's for general caregiving. Anyone can attend that if you're a family caregiver. And we're going to talk about balancing life, making sure that you're caring for yourself, getting organized. It's also just a really wonderful opportunity to meet other caregivers. It's a very small class setting, so you are able to ask questions and learn about resources along with just really wonderful course material. The Empowering You is also on, we have a falls prevention one, so it's a Prevent Falls course. And then we have the Strategic Dementia Caregiver class. So again, these are similar to the 6-week session classes. They're just in a little bit more of a condensed format, because we do know that everyone is busy, and depending on your particular schedule and your life at the moment, one of these might be a better fit for you. So that's our CaregiverU program. I want to mention really quick before I move on, that these classes are at no cost to you. You can find the classes online. We update our class schedules as soon as we get word that a class is going to be available. We have wonderful partner agencies out in the community that are trained class leaders, and they will notify us that they are ready to teach it, an Empowering You class or a Savvy Caregiver class, and they'll send us all of the information, who's the registration contact, and we put it on our website. So you can see all of that on the AGE website under the CaregiverU program tab. And all you have to do is connect with that person who is linked to registration, get your class materials, which we provide to you, and show up. That's it. we try to make it as easy as possible. And again, this is at no cost to you. Okay. Let's see if it stays on that slide. Okay, good. And so now I want to hand it over to Casey Lawrence, our wonderful program director for the Virtual Connections program.
Thanks, Natalie. Can everybody hear me okay? Awesome. Well, I'm so glad that y'all have joined us this morning to learn more about the programs that we offer and the resources in the community to support you as caregivers. As Natalie said, my name's Casey Lawrence, and I'm the program director for the Virtual Connections program. And this is a program for people who are experiencing changes in memory or cognition. You don't have to have a diagnosis related to memory or cognition to join us. And these are engaging small group activities that are offered over Zoom in a monthly subscription format. So we really offer a really wide variety of activities, and they're all intended to promote brain health and peer social connection. So we have things like brain boosters, trivia, puzzles, and word games, live music, music therapy, name that tune, social hour bingo, a peer support group where people who are living with changes in cognition can talk about what they're going through with other people who are going through the same challenges. We offer seated physical exercise, then the opportunity to learn new things through presentations about travel or various other topics. So we really try and bring a really wide variety of activities. And what we do is we talk with the older adult and the care partner in our intake process to find out what are your goals, what are your preferences, the older adult. And then we look at all the activities we have to offer. We have about 12 activities a week we offer, and we'll create a personalized schedule of activities for the older adult. And I have a sample activity slide. Actually, Natalie, would you move forward to that sample activity slide? It's 2 slides ahead. Thank you. So here's a sample schedule. Again, we offer a variety of activities. This is just an example of a schedule we might provide to a client. And as you can see, there's quite a few activities. Like there's 2 activities on Monday and 3 on Wednesday. Some people like that kind of variety because if their Mondays and Wednesdays are busy, and then they know, okay, if I miss the morning one, I can go to the afternoon one. Some people only want to have 2 activities a week on their schedule, and they want it to be really a minimal schedule so they know what's on there is what they like, and those are the ones they're going to attend. So again, we will create a schedule just for you. You know, if someone doesn't like music, we're not going to put name that tune or live music on there. You know, if someone doesn't want to do bingo, we're not going to put bingo on their schedule. And so that's where I think it's really helpful because when you're encouraging the older adult or when the older adult is looking at their schedule to come, they know these are the things that they really want to come to, that they're really interested in coming to. We also have a list of all of our activities with descriptions for each one. So for example, on here, you'll see that I've written Zumba at 12 o'clock on Wednesdays. At our actual schedule, we call that Move and Groove because a lot of people don't know what Zumba is, and we don't want you to have to Google it or explain to anyone what it is. We want it to be really appealing for people to just come and try it. And so this is a sort of an example of what we offer. So the monthly subscription fee is $100 a month, but we do offer a sliding scale fee because we don't want finances to be a reason that people don't participate in our program. So if finances are an obstacle or technology is an obstacle, please don't let that stop you from reaching out to us and finding out more about the program because we're here to help overcome those obstacles as much as we possibly can. All right, Natalie, we go back 1 slide. There we go. Thanks so much. Sorry about that, everybody. So these are just some quotes from our participants talking about how the program benefits them. So these are small group activities. So there are between 5 and 15 people in each activity. And the activities are really designed for people who are living with changes in cognition. So what we want to do and what we try to do through our really experienced facilitators is create a positive atmosphere, create a positive environment. It's a strengths-based program. So we really encourage and validate what our participants can do. And we provide support strategies not only to help them attend independently, but also to help them succeed in the activity. So for example, when I'm leading brain boosters and we're doing trivia, I'm selecting trivia that will hopefully be at the right level of challenge for that group. So it won't be too hard, it won't be too easy. It'll be doable for that group, but maybe a little bit challenging. And then I always tell our group, it's not about getting the right answer. I tell them there's no grades, there's no points, there's no gold stars. I'm fresh out of gold stars today. Won't be giving any of them out to anybody. It's really just about getting that brain exercise by putting forth that effort, and that guesses are welcome. And so if somebody guesses or provides an answer that is outside the rules of the activity, there's no, correcting them. I'm like, oh, that's such a creative answer. I love that. I'm wondering, I think we're missing an R. So as much as I love that word, I don't think we can make it today, but let's make more words together, right? So it's very positive and encouraging, and hopefully people feel like they're accomplishing something and they feel like they're being challenged. The other thing that I wanted to highlight for you is some of the benefits that our participants talk about. So we have noticed really kind of two major benefits that people talk about. One is social connection. So as you know, if you are caring for someone who's living with changes in memory or cognition, that person might feel isolated or alone. They might not know anyone else experiencing those changes. And so this is really a chance for them to make friends and connect with other people who are experiencing some of those same challenges. And then they know they're not alone. They often feel understood and accepted where they are and who they are in their disease process. So a great example of that is, we might be in a group and someone will say, I forgot what I was gonna say. And other group members will say, you're in the right place. That's okay. Don't worry about it. And then I'll say, if it comes back to you, let me know. And then we just move on. So there's really this very accepting and supportive environment. I think the other benefit that people often mention is that the activities are challenging and engaging. They can do them, and they can do them independently. So we know from the research that doing activities together can provide both brain exercise and social connection, and that having activities that are personally relevant have more benefit for the individuals. So we try and bring activities that are personally relevant, that provide that brain exercise. And then when our participants, get an answer right, or are close to getting an answer right, or they've just completed the activity, whether or not they got any of them right, they often feel the sense of validation and accomplishment. So maybe they're learning something new, or they're connecting what they're learning to their life experience, and they're sharing it with the group where it's really valued. So for example, we might give a presentation on travel, and maybe that week we're traveling to Japan, and we have someone who's been to Japan and they can share their experience. And if they happen to be repeating the same story, everyone's excited to hear it every time they share it. And we make sure that everyone has a chance to share. We call on people throughout the hour, not to put them on the spot, but to really make sure that they are engaged and really get a chance to participate. So we've had care partners say, you can get my person to do things that the doctor or maybe the speech therapist suggested they do that we can't get them to do at home. We just get them to log on to Zoom and say, hey, you're going to see your friends. And we encourage them gently to do it. There's always the option to pass, of course. But I think, I've heard people say, we get on, I log my person onto Zoom and they're not sure they want to go, but as soon as they log on, everyone's like, hi, it's so great to see you. And they just feel, like they're really with this group of very welcoming friends. I think another benefit is something to look forward to and create routine in the day. So because there's a schedule every week, the person living with cognitive changes and their care partner know these are times that they can do things independently. The older adult goes to their online class or group, and the care partner goes and does something else, knowing that they don't have to support that person through that activity. We've got them. And there's no obstacles, right? Often people with memory loss are not able to drive anymore, and they have to rely on others for transportation, and that can be a logistical challenge for both them and you. And so by having the classes over Zoom and having them, 60 to 90 minutes throughout the week, hopefully making these activities in these groups really accessible for everyone and really at a length that everyone can really enjoy. If you're interested in learning more about virtual connections, we're more than happy to speak with you. We'd love to talk with you. The other thing that we often do is if people say, oh, what strategies can I use at home to help my person, complete this activity or start this activity? I'm having a hard time, encouraging them to, take their medicine in the morning or brush their teeth. We're more than happy to brainstorm that with you and just give you some suggestions for things that you might try to maybe make your daily routine smoother at home. So we're happy to talk to you about our program, and we're also happy to support you in your role as a care partner as well.
Thank you so much, Casey.
Thank you.
I am actually going to hand it off to our other wonderful program director, Lauren Greenwade. And let me get the next slide going. It's a little slow on my end.
Okay.
And I'll hand it off to you, Lauren.
Thank you. We're all a little slow on a Saturday morning. I'm Lauren Greenwade. I'm the program director at our Age of Central Texas Thrive Social and Wellness Center. We actually have two centers. We have one in Austin that has capacity of about 50 people, and we have capacity of 37. We haven't been there lately because of COVID, but we're encouraged now with everyone being vaccinated and the restrictions being reduced that we're probably going to be growing our numbers again. So that's very encouraging for everybody because we have a lot of people on a waiting list. We are a weekday care. We're open at 7 in the morning and we close at 5:30. Some people come at 7 and leave at 5:30. It depends on what their caregivers need. It's a social wellness support for older adults with physical and cognitive needs. We have a lot of people that have dementia. We have a lot of people that have special needs. And we have some people that just have like a heart condition that aren't safe to be home by themselves and they want the socialization. So we pretty much accept everybody. We pretty much narrow it down to 55 plus, but we do have some exceptions to that rule. We're staffed with a full-time nurse, and it's an LVN, who assists with medication management and health monitoring. And this is a huge help to families. We kind of become partners with you guys. If we notice suddenly someone's behavior's changed a lot, we know that usually is like a UTI or there's something else that's physically going wrong with them. So we'll talk to you about it. We kind of become partners with the caregivers. And my nurse is fantastic at that. We serve meals. We have breakfast at 9:30, lunch at 11:30, and then a snack at 1:30. And we provide transportation. And we also have a ton of engaging activities. She's created the calendar for us on the next page that I'll show you when I end to show you all the things that are going on. But all of that is included in the price. Medicaid pays for people to come to our facility, and we usually use Natalie to help us with resources for people that aren't sure if they qualify for Medicaid or not. The two sources that help us with the Medicaid are United Healthcare or Amerigroup, and they pay for the people to come, so there's no expense to you guys. The only challenge with that is they have to stay with us at least for 6 hours for that day. Otherwise, we only get paid $16 a day instead of $32 a day. So the VA pays for a lot of people if they qualify. So we always encourage people to at least investigate it versus assuming that they're not going to get it because they make too much money. And it's always worth asking the questions. With the VA, you generally have to go visit the VA. Not generally, you have to visit the VA doctor one time to at least get the orders for them to pay for the program. But you don't have to give up any of your own doctors. You just have to visit them once. Most people don't have, a few people do have long-term care insurance. And the ones of you that do have it, God bless you, because it does pay for adult day centers. And it's very easy way that we do it is you guys tell us what the company needs and we provide them everything. They need a copy of when the person attended and a copy of the invoice that you paid, and then they reimburse you. So that's a nice benefit people don't know about. Our private pay is $70 a day. And we also have a needs-based application sliding scale. So if someone doesn't qualify for Medicaid, but they don't make enough to pay the $70 a day, we work with them. So we kind of have a mixture of everything working for that. And I want to tell you guys some stories. Is we call everybody a member that comes to our place. So it's much easier to come to our social club when you're going to be a member and you're going to be helping us participate. And our main things as the staff does for the members is to love on them, feed them, take care of their medical needs, stimulate them, and send them home exhausted. And usually I get cheers from the caregivers when they hear the part about sending them home exhausted. And we've had some people recently said, you know, I need to let my dad take a nap during the day because he comes home so tired. And the daughter wants the dad to be engaged, and the mom's like, oh, thank God he's tired. So, you know, we kind of have to, we work with whatever works for the caregiver. The daughter wants the dad to come home and tell him everything he's done, and he's not going to remember everything he's done. And the mom's just happy that dad's like mellow. So that's kind of our job, is wanting to keep them happy. The caregivers are just as important to us as the members, because you guys need some place to just throw up all your concerns and all your stress and your frustrations, because you've got a lot of them. And I have one lady that she came in one time and she said, Lauren, I just want to put him in the driveway and run over him a couple times with the truck. And I said, it's okay to think that as long as you don't ever do it. But that's what it's about, is you guys have so many frustrations because of this. They're not choosing to do what they're doing because they have brain damage. Their brains are shrinking. So it's really frustrating. So we also really encourage you guys to join a support group, because it's good for when you can talk to someone that's helping go through the same process you're going through. We have one gentleman whose wife had frontal lobe disease, and he came to us like 5 years after she had already passed, because he still wanted to come in and just share being part of the group. And the support group changed his life. And to have a man tell you that a support group changes his life is kind of amazing. And it's where you have to be vulnerable. And I know you don't feel like you have time to take care of yourself. As Natalie mentioned in all the classes that we have, taking care of yourself is the most important thing, because you can't give from an empty vessel. And that's why we want to be as a respite for you. We also encourage respite stay. If there's times when you're just fried beyond fried, then we have places that you can put your loved one to stay for a night. And that, so many people are like, oh my gosh, I didn't even know that was an option. So that's an option that we help you with. And also with the, we help you with needs. Like with COVID, it kind of changed everybody's life. And one of our caregivers called us and said, my mom won't ever change her pull-up and won't let me change her pull-up. And so this was a big frustration for her. So my activity director looked up videos to find out best ways to deal with this. And then we also talked to her about, you can't scream. And I know it's really hard, because you do get so frustrated and you think they're choosing to do this and they aren't. So when you get really mad at them, it's better for you to walk out of the room, count to 10, breathe a little bit, scream in your pillow, do whatever you need to do to get some relief, and then come back and address it with them. Once this caregiver started to not scream at her mom was willing to listen to her and try, and was fine for having her change her pillow. So that's a hard part, is when someone's screaming at you, they don't know why they're being screamed at. So that's what, I've been here for 8 years and have experienced a ton of all of this. So that's why I'm kind of giving you guys examples of things. And that's why we're here, is so you guys get that release that you need. Whether, you know, you bring them for 8 hours a day, that's great. You can go play cards with your friends, go get your hair done, go take a nap, go take a class. A lot of people love that they can go take classes. So we want to do stuff for you guys. We have one other story I want to tell you, is we had a gentleman who, once he found out he had dementia, he just went straight to bed for a year. And his daughter was like, no, this dad, you're way too active. This isn't appropriate. And she found out about age. And when he came in, I said, hey, I need someone to help me around here. And he's like, oh my gosh, I am here. And so we try to give everybody a purpose, and they love it. He greeted everybody for us. He swept all the time for us. We never knew where the broom was, but he was always doing it, and it was always with joy. And he was going 5 days a week, and his wife finally said, you know what, Lauren, he's exhausted from working so much. So we reduced him to 4 days a week. We're really flexible to work with you guys. People that aren't good fits for us are people that take 2 people to assist them. If they can't use their lower legs at all, then it's really hard. If a lot of people have bags, which we're fine with, and we'll accommodate those. But if it takes 2 people of my staff to go in to take them to the bathroom, that's when they're not a good fit for us. But we help you guys find a place. And I have to tell you, we had one lady that she came in and she just she was a 2-person assist. And I told her daughter that she couldn't come to our place. And the woman got so motivated because she loved coming that she strengthened herself to where she could do just a 1-person assist. So she actually stood on that one leg so that my staff could get her to the bathroom. And she was with us forever. So there's just motivation of taking care of people. And then the reason we survive is we're not related to them. You guys are their daughters, their wives, their spouses, their children. They have no filter with you. They have filters with us. And that's how we can survive. And we're kings and queens of redirecting. And then we teach you guys how to do that. And we teach you all sorts of things to help make your lives a little bit easier. And that's what we're here for. So I'm going to just, if you don't mind, Natalie, we'll show them the calendar. This gives you an idea of how busy their days are. And we let them all come in and say what they want to do and what they don't want to do. We adjust things. Our group loves bingo. My group loves bingo. So they get really upset if I ever try to reduce bingo. But, and some people want to take a nap and we let them, we have a bed. And so if they want to go in there, it's just funny when they say, oh, someone else is going to take a nap with them. And the gentlemen are very welcoming of that. We all laugh. And we say, no, you can't take a nap together. But we let them rest if they need to rest. We let them take care of each other. And it's a very free-flowing thing. And it's very busy. And my new activity director is Greek. So she taught them all how to dance Greek the other day. So it was very fun to watch them all trying to keep up with her. So that's our main thing, is just to keep them stimulated and provide a place for you guys to come and just ask a million questions or just tell us everything you need to get off your chest. That's what we're here for. And I know we'll have some questions we can answer.
Absolutely. Thank you, Lauren. And you made some really great points that I will actually touch on here in a little bit. And I just want to also say, again, if our program ends up not being the best fit for you, we will absolutely help you with finding another place that is important to us. So let's see if I can get the next slide going. There we go. So I'm now going to talk about some resources in the community that are just really just should be on everyone's radar. I'm just going to briefly touch on this because I could honestly talk about all of these all day long. And so if you want to talk about these, the in-depth, please, I encourage you to reach out to me so we can have our consultation. But this first resource that I want to share with everyone is the Caregiving in Central Texas Guide. The image that you see on your screen is the cover of the booklet. And this particular community resource guide has everything in it. It is a collaboration between lots of different agencies, age included. We all take parts of this guide, we work on them, we update them, and then the most recent edition will be printed. So we do have a 2021 edition that is now available. We have hard copies of these guides at our office. So if you do want one, please reach out to us and we can always set up a time for you to swing by to pick up a guide or a couple of guides. You're welcome to share as many with your friends and family and neighbors. But this particular guide just has lots of resources from case management to hospice to transportation, from just lots of different topics and areas of support for you as a family caregiver and just for older adults in our community. I will show you after, if we have a little bit of time, I'll show you what this actually looks like. And I'll just briefly show you. But I, again, encourage you to reach out if you need it or want a hard copy of it. There will be a follow-up email that will be sent out on Monday, and I will have the link to the PDF version of this for everyone. So you will receive a PDF version of it. But if you want a hard copy, you can reach out to us and we can get that to you. So another really wonderful resource that you will receive in a PDF version is the Greater Austin Transportation Services and Senior Ride Guide. This particular transportation guide has Cap Metro information, and it has, if you're looking for Metro access information and wondering how do I get signed up for that program, that information is in this guide. It gives you the contact number to call if you want to inquire about ADA transportation. This guide also includes local nonprofit agencies that provide services at no cost to you, like Drive a Senior. There are lots of different Drive a Senior branches, and their information is in this guide. And also other transportation resources for in the surrounding areas, not necessarily just in Travis County. But we have some Williamson County resources in there, like Faith in Action in Georgetown. They're a wonderful resource for that particular area. And so transportation is always a challenge when it comes to our particular area. And this guide really just provides you with the information that you need and to at least get going in the right direction to establish services. So I'd like to mention that. I also just like to remind everyone that 211 is a great resource to use. It's a call line, and this particular 211 will connect individuals to nonprofits and government agencies in our area that can assist you with the needs that you are looking for support in. And it is, like it says, it's simply dial 211. They are also able to provide referrals to agencies. So this is, this service is at no cost to you. They're a wonderful, wonderful resource just to utilize. And again, referrals. As I move through the different agencies that I have listed, a lot of us will submit referrals to each other and to different agencies on your behalf. So please, if you are, just know that if you are calling us and we have a one-on-one consultation and one of the Meals on Wheels programs might be, something that you're interested in learning more about or seeking, we can submit a referral on your behalf to that agency, and it'll eliminate that call that you have to make. Let us submit that information to them on your behalf so that they will call you, and you're not having to call around and take that extra time to take care of that task. Another really wonderful resource I like to share with people is the findhelp.org, which is formerly Aunt Bertha. You can go to this particular website and use their search tool to type in the type of resource you're looking for. So if you're looking for financial assistance or housing, you can search on this particular website for those specific organizations that can assist with that type of service you're looking for. It's a free online tool, so everyone has access to it. If you don't want to deal with that, you can always just call us again, and we can assist you with finding the resources. But this is a really just wonderful, another wonderful general resource I like to share with people. The Area Agency on Aging is another agency that we work very closely with. They are the agency that we also put on the Striking a Balance Caregiver Conference with. their agency offers really wonderful resources for older adults and caregivers. They're able to also provide information and referrals. They have an ombudsman program. So if your person is living in a community care setting and maybe they're experiencing some challenges with that particular care community, you can always reach out to the ombudsman program that is within the area agency on aging, and they will assign you an ombudsman, and that individual will then is like an advocate for your person, and go and figure out what's going on with that particular care community. So that's a wonderful program that they have. They also offer benefits counseling, which is they are the Medicare guru. So you contact them with all Medicare questions, and they are able to provide you with local plans and support programs all around Medicare for our area. So any Medicare questions, I would contact the Benefits Counseling Department with the Area Agency on Aging. They also have health and wellness education, kind of similar to like what we provide with CaregiverU, but they offer some other classes for individuals who are maybe living with a chronic illness. They can also provide respite assistance. So through their caregiver support program, they are able to provide you with a full assessment of your situation and then in your needs. And then they are also able to connect you with in-home care that is provided to you temporarily. This is such a wonderful program to use. It's at no cost to you. All of their programs are at no cost, but they are temporary. So again, if I can also go into depth with their particular programs if we set up a one-on-one, but they can provide you with some respite care temporarily, and also just additional support for you as a family caregiver. The Capital Area Aging and Disability Resource Center is also a really wonderful organization. They are able to assist with a variety of services and benefit programs. They can often help with Medicaid application assistance. They can help with housing navigation. They have a interactive map on their website that you can use to see affordable housing. And so that's super helpful if you're looking for housing support or resources. They also have a lifespan respite grants program. And this is a grant program for caregivers. So for example, they can provide you with some additional funds to be able to pay for some in-home care, or that particular money can maybe help with the cost of our Thrive Social and Wellness Center. So a community program that provides respite care, if an individual qualifies for this particular grant, they could be awarded some compensation for to be able to receive in-home care, or money towards attending our program. And they also have an Energy Plus One program partnership. So this can be an emergency or just assistance when it comes to financial assistance for your utilities. So if you know anyone who might benefit from their resources, I encourage you to pass on their information to them, to this particular resource at the Aging and Disability Resource Center. Housing along with transportation is also a challenge in our area. So in finding affordable housing, I'll share this PDF PowerPoint with everyone, but you will be able to, this particular resource is great for finding affordable housing opportunities, and housing authority information, homeless resources, and special needs housing. They have several interactive maps that you can use, and this is all through the U.S. Department of Housing and Urban Development. So again, everyone will receive this information. So if you are interested in finding some, affordable housing or specific type of housing for your person or for yourself, this is a wonderful resource as well. It's an interactive map. So I often receive calls from individuals who are maybe exploring a community care setting, so which is like a memory care or an assisted living. And so there are a lot of options here in our Central Texas area, and that could be overwhelming. I always share with individuals to seek out a senior living advisor. Their service is at no cost to you. They operate similar to leasing agents, where they will assist with finding the place that would be best for your person or you based on finances, location, needs, the type of care that an individual is going to need. They can help with that search because, again, there are so many options here in the area that it can be very overwhelming to even just Google assisted living or memory care. And so what they'll do is they'll provide you with a list, and you check out those locations. And if you decide to pick one of them, they receive a referral and are compensated that way through the place that you end up picking. Again, they are at no cost to you. There is a couple of other options for searching for community care settings. Through the Texas Health and Human Services long-term care provider search. And you can also use the medicare.gov link that I have here. And that will give you options to read any reviews and also just compare prices in community care settings. So I know I want to leave some time for some questions, so I'm going to move through these quickly. So Meals on Wheels, I want to just mention to everyone, they have more programs than just delivering and serving meals. They have a in-home care program that is, I believe, I better not say that. They have a private pay, and then they have a sliding scale side of in-home care. So not a lot of people know about this particular program, but I want to just, share with you that they do offer other services than providing meals to the community. They also offer a home repair program for minor repairs. They have a really cool program that's called PALS, and that's pet assistance in care. Sometimes someone who might be living alone has a pet, and they may need to go in for a procedure and will be out of the house for a little bit, but they need some assistance with their pet. So they partner with Austin Pets Alive to provide that type of help. And then you have the HOPE program. It's grocery delivery for older adults. So I just wanted to put that out there, that Meals on Wheels is also another wonderful organization with different programs outside of just serving nutritious meals. Family elder care is also wonderful. They offer in-home counseling. They have a phone program that is like activities, but over the phone. That's through the Lifetime Connections Without Walls program. They also offer service coordination and money management and guardianship. So that's the guardianship would be for an individual who's living alone and may not have family in the area or close by, and they want to hand over, care at some point to someone outside of their family or a friend. They can go through and inquire about their guardianship program. But again, this is Family Elder Care. AARP Texas is also a wonderful organization to reach out to for resources and just lots of caregiving assistance and referrals to organizations in the community. I encourage you to check out their information online for more details on the different resources that they have. Of course, we have Alzheimer's Association, which provides really wonderful online resources, support groups, and a hotline. I believe I left off on accident. Sorry about that. I'll share that with you in the follow-up email. But they also just have wonderful educational programs and seminars and just they're a wealth of knowledge and resources. And then we have Alzheimer's Texas that has a really wonderful list of respite care programs here in our area. I will also share that with everyone in a follow-up email. And they have a toll-free helpline for the family caregiver or an individual who is in need of some assistance and support. But they have support groups and a list of respite care opportunities here in our area. I like to mention NAMI Central Texas for mental health resources, because our mental health is absolutely important, especially as just humans and caregivers. And then they do offer support groups and some free classes for you if you're interested in some support. I'd also like to mention, and I'm just mentioning Texas Rio Grande Legal Aid. There are a couple of other legal aid organizations here in our area that can provide low-cost assistance to when it comes to legal assistance. So just know that there are other resources, but this is one of them that I decided to include that's been helpful to our families and community. And if you want additional resources, again, you can always reach out. I'd like to also mention, because it's been mentioned a couple of times, different ways to find assistance and resources and support are through support groups. AGE has some really wonderful support groups that we have, and I facilitate one that's in Buda. We meet the third Tuesday of the month, and we will be meeting in person starting in July, which is super exciting. I like to mention just the value of attending a support group is incredible, because everyone is in a similar situation. No person's journey is the same. And there are so many creative caregiving techniques and tips that are shared within a support group. And it's also just a space to talk about the struggles and also the really, wonderful, powerful moments that caregiving has to offer. So I encourage you to check out some of our support groups and check out a few, because one group might not be what you're looking for, but another group that we have might be a great fit. So allow yourself that, that if you join one group and you're maybe not too sure about it, try another group. They're super helpful. Counseling support, seeking out a counselor for yourself and in wherever you are at in your life is always just a wonderful support that you could provide to yourself. We have a great list that we share with everyone if you are looking for a counselor or that type of emotional support. We can help you with not having to go search on the internet for that. Geriatric care managers are wonderful. They can step in and relieve a lot of the weight that comes along with establishing services. They can step in and assist you with that. They can also be a third party to help navigate really difficult conversations that comes with long-term care planning. And so that geriatric care managers are an incredible resource in the community as well. I also encourage you to reach out to disease-specific organizations. So your person might be living with a certain type of dementia. Google that type of dementia and see what kinds of organizations come up and reach out to them specifically, because more than likely they have their own support group and services as well. But that's another way to also just like build your supportive network. And then subscriptions. There are lots of like free subscriptions. I believe like dailycaregiving.com is a really wonderful one where they send you an email once a day with just lots of different topics and tips and tools related to caregiving. So I just wanted to mention those really, other resources that are in our area. And I believe that's it. So I'm going to stop sharing my screen. And does anyone have any questions? If you want to drop it in the chat box, you're welcome to do that, or you can unmute yourself and ask your questions. And if you don't have any questions, that's okay too. Casey and Lauren, do you all have any additional comments to share with?
I'd just say if you're interested in the adult day centers, I forgot to mention that the other program director in Austin is actually another Lauren. She's the younger Lauren. I'm the old fart Lauren. So, but you can reach out to our facilities and we're scheduling assessments. And to start the process, we just need to know like your loved one's name, date of birth, and their doctor. So we get the doctor's orders and that starts the process. Given that we're hoping to be opening back up in the next couple of weeks, if we can help you guys, we totally want to.
Thank you. So I did have a question about the BUTA support group. So we will begin our in-person meetings in July. It is the third Tuesday of the month. So 1, 2, 3, the 20th of July. And we meet at the Onion Creek Senior Center. We meet from 12 to 1 or 1:30. It just depends on the group, but we do have a hard stop at 1:30. So if you're interested in that, we will, I'm going to send you quite a bit of information on the follow-up email on Monday. So I will include some support group information as well.
Well, this is Nathan. I just wanted to thank you for the presentation. I found it very informative. Good to have information that we can look up when we need it. So thank you very much.
You're welcome. Thanks for spending the morning with us. And again, if anyone has specific, information about our programs or just additional resources in the community, because we are I consider us very lucky to be in the area that we are. We do have some really wonderful resources to support older adults and family caregivers. And so we are always here to talk and to help you all, the best way that we can.
Don't be shy. If any of you have a question, you've got 3 resources right now. I'd be glad to help you with anything.
And like I said, that's okay if you don't have any other questions. So I will go ahead and just wrap up and remind just tell everyone that we will be sending out a recording of this session, a survey that I encourage you please to fill out. We love your feedback. That's how we improve our programs. And we also, and then we also will be, we plan ahead based on the feedback that you provide. So we'll be taking into consideration all of the topics that you are interested in learning about for our 2022, I cannot believe I'm saying that year, programs and seminars. And then I have put together a resource packet for everyone. I'm also going to include a link that you can use to just go ahead and schedule an appointment with me if you want to. It connects to my schedule, so you can just pick a time that works best for you, and we can meet. And then all of our contact information about programs and all of that. So there's going to be a lot of information in an email coming to you all Monday. So just take your time going through it. And then reach out to us if you have any questions. So we have a few minutes left, and we do have a couple of questions. We have someone who is curious about medical power of attorneys, et cetera, and legal resources. And so, yes, there are wonderful ways to get all of the paperwork needed. And actually, in the resource packet, I have included a list of just really wonderful documents that everyone should have together. So you'll be able to see that. But I will mention that Hospice Austin offers, they have a program designated to assisting people with all of their advanced directive paperwork. And their program is no cost to you. You can reach out to them. It's their gift project, and I'm going to make a note of that to share. They're a wonderful resource. And then also just other legal assistance entities here in our area can assist with that type of paperwork planning. And let me make sure I have that written down to share with you all. So I have a question about some more programs in Hayes County, closer to Dripping Springs. I can provide you with some additional information outside of this conversation. There are a few, and I'll get that to you. And so our health equipment lending program is located at our central office, our Central Austin building. It's the 3710 Cedar Street location. We're at we're near the intersection of Guadalupe and 38th Street. And so it's Central Austin, and that's where you can find durable medical equipment and incontinence products. And just to remind everyone that we are still operating on an appointment-only basis. So please call us ahead and let us make sure that we have the right piece of equipment or the supplies that you're seeking, and we will set that aside and schedule a time for you to pick up. So visiting nurse services in Georgetown. So there are different ways. There are a couple of ways to receive that type of assistance through a home health agency, and usually that is ordered by your primary care physician, or one of your specialists can also order that for a nurse to visit your home, and that typically has to be renewed after a certain amount of time. So if you do end up setting some home health up, which I encourage you to reach out to your primary care physician or a specialist that you see to receive this service. That is usually provided through Medicare and or covered through your insurance, but only for a certain amount of time. And so there will be a moment where that paperwork has to be resubmitted by that doctor. So yes, that's a really wonderful way also to receive occupational therapy and physical therapy as well, which are super important for everybody as we age. And just
Thank you.
really just go through life. You're welcome. All right. Well, I will go ahead. Thank you all for your wonderful questions, and we'll go ahead and wrap this up. Again, thank you for joining us this morning. It was a pleasure to get to see your faces and just spend some time with you. Again, I hope this was helpful, and reach out to us. Anyone you call at our agency will be able to assist, and we will get you to either the right person, or we'll be able to just help with some, additional resources to help. So, all right. Well, have a
Thank you.
wonderful day. Yeah. Thank you.
That was great. Thank you very much.